Hi, my name is Daisy Wang, and this is my presentation on the barriers to successful reentry after incarceration. Formerly incarcerated individuals face significant challenges upon reentry into society, often encountering systemic barriers that hinder their ability to secure stable housing, obtain meaningful employment, access healthcare, and reintegrate into their communities. These barriers, rooted in policies and societal perceptions, contribute to high recidivism rates and ongoing marginalization. Despite efforts to promote rehabilitation and reintegration, many individuals continue to struggle due to restrictive policies, employer discrimination, housing instability, social stigma, and limited access to mental health and substance use support. The cumulative impact of these challenges exacerbates socioeconomic inequality and disproportionately affects marginalized populations, particularly Black and Hispanic individuals, who are overrepresented in the criminal justice system due to historical and systemic racism. This issue is critical to macro social work practice because it highlights the intersection of criminal justice, social policy, and community development. Addressing barriers to reentry is essential for promoting social justice, reducing recidivism, strengthening communities, and improving public safety. When reentry policies and programs fail, individuals are more likely to return to the criminal justice system, perpetuating cycles of incarceration and poverty. By advocating for evidence-based interventions, policy reforms, and community-driven solutions, social workers play a vital role in creating inclusive, rehabilitative, and equitable pathways for successful reintegration. The purpose of this presentation is to assess the community and organizational landscape related to reentry conditions for formerly incarcerated individuals. This assessment will include findings from community engagement efforts, a review of professional and academic literature, and an exploration of effective frameworks and interventions. Through this work, I seek to foster a more just and supportive society that facilitates successful reintegration rather than continued exclusion. Insights from community and organizational members. Through engagement with at least 5 community members, including formerly incarcerated individuals, service providers, and advocates, key themes emerged regarding the systemic challenges faced during reentry. Participants shared personal experiences of employment discrimination, housing instability, and the emotional toll of societal stigma, all of which impacted their ability to reintegrate successfully. Many emphasized the lack of transitional support and limited access to mental health and substance use services, making reintegration even more difficult. From an organizational perspective, professionals working in reentry services highlighted gaps in funding, policy enforcement, and interagency coordination that hinder efforts to provide comprehensive support. They noted that while some programs exist to assist with reentry, eligibility restrictions, bureaucratic delays, and inconsistent resources prevent many individuals from benefiting from available services. Common themes in reentry challenges. Employment discrimination. Employers frequently reject applicants with criminal records, despite ban-the-box policies. Many reentry programs focus on low-wage or temporary work, rather than long-term career opportunities. Housing restrictions. Many formerly incarcerated individuals are denied access to public housing and private rentals due to background checks. Limited transitional housing options lead to homelessness or unstable living conditions, increasing the risk of recidivism. Social stigma and marginalization. Community members often experience social isolation and are treated with suspicion, limiting their ability to rebuild social networks. Many feel permanently labeled by their incarceration, reinforcing cycles of poverty and exclusion. Lack of mental health and substance use resources. Incarceration is a traumatizing experience, yet few resources are available for mental health support upon release. Individuals with a history of substance use disorders, often struggle to access consistent treatment and face relapse risks due to lack of medical and social support. Historical and contextual influences. Mass incarceration policies. Harsh sentencing laws, mandatory minimums, and the war on drugs have disproportionately incarcerated Black and Hispanic individuals, increasing re-entry difficulties. Racial disparities in sentencing and supervision. Communities of color face higher incarceration rates, harsher sentences, and less access to parole opportunities, worsening post-release inequities. Policy and structural barriers. Systemic policies restrict access to employment, voting rights, public benefits, and education, reinforcing cycles of disadvantage. To gain a comprehensive understanding of the barriers to re-entry for formerly incarcerated individuals, multiple data collection methods were employed, including interviews, focus groups, and surveys. These methods provided a holistic perspective by capturing both qualitative narratives and quantitative trends related to systemic challenges. Engaging with individuals directly impacted by re-entry policies, as well as professionals working in re-entry services, allowed for a nuanced understanding of the lived experiences and structural barriers that shape the reintegration process. Interviews were conducted with formerly incarcerated individuals, community leaders, and re-entry service providers to gain insight into the personal, social, and economic challenges that hinder successful reintegration. These semi-structured interviews facilitated in-depth discussions on employment discrimination, housing instability, social stigma, and access to mental health and substance use treatment. Qualitative research highlights the importance of personal narratives in understanding complex social issues, as they provide context to systemic problems and identify gaps in existing policies. Additionally, interviews with community leaders and service providers offered an institutional perspective on resource limitations, policy enforcement gaps, and best practices in re-entry programs. Focus groups were utilized to capture a diverse range of perspectives on re-entry challenges. Participants included individuals with direct experience in the re-entry process, advocacy groups, and nonprofit representatives working on re-entry initiatives. Focus groups provided an opportunity for collective discussions, fostering a dynamic exchange of experiences and ideas. This method allowed for the identification of common challenges across different demographics, revealing patterns in racial disparities, policy barriers, and community-based solutions. The interactive nature of focus groups also encouraged participants to validate and build upon each other's experiences, strengthening the reliability of qualitative findings. Surveys were distributed to quantify trends in re-entry experiences and measure the prevalence of identified challenges. These surveys included both closed-ended questions, such as rating the difficulty of obtaining employment post-incarceration, and open-ended questions that allowed respondents to share personal insights. Quantitative data from surveys provided measurable evidence of systemic barriers, highlighting issues such as the percentage of formerly incarcerated individuals denied housing due to their criminal record, or the rate of job rejection despite ban-the-box policies. Surveys also ensured broader participation, capturing responses from a larger sample to complement qualitative insights. The rationale for selecting these methods was grounded in their ability to provide a comprehensive and multidimensional analysis of re-entry barriers. Interviews and focus groups allowed for an in-depth exploration of lived experiences, while surveys helped identify trends and patterns in re-entry outcomes. By triangulating these data collection strategies, this assessment ensured a balanced representation of both individual experiences and systemic factors, strengthening the validity of findings and informing evidence-based recommendations for macro-level social work interventions. Formerly incarcerated individuals, particularly those from marginalized racial and socioeconomic backgrounds, face significant structural barriers to successful reintegration into society. This focal population includes individuals who have been released from incarceration within the past 5 years, a critical period when they are most vulnerable to employment discrimination, housing instability, social stigma, and limited access to essential support services. These challenges disproportionately affect Black and Hispanic individuals, who are overrepresented in the criminal justice system due to historical and systemic inequities in policing, sentencing, and incarceration policies. Without adequate resources and policy interventions, these barriers increase recidivism risks, reinforcing cycles of incarceration, poverty, and exclusion. The primary difficulty facing this population is the intersection of restrictive policies and societal stigma, which significantly limit opportunities for rehabilitation and self-sufficiency. Employment discrimination is a major obstacle, as many formerly incarcerated individuals are automatically excluded from job opportunities due to background checks, despite policies such as Ban the Box, which seek to reduce hiring bias. Similarly, housing restrictions prevent individuals with criminal records from accessing public housing and private rental markets, often leading to homelessness or unstable living arrangements. The lack of accessible mental health care and substance use treatment further compounds these difficulties, as many formerly incarcerated individuals experience post-traumatic stress disorder, anxiety, depression, and substance dependency, but face systemic barriers in receiving adequate care. Addressing these challenges requires a multi-level policy approach, including criminal justice reform, increased funding for reentry programs, and advocacy for fair hiring and housing practices to support successful reintegration and reduce recidivism. Research on the reentry experiences of formerly incarcerated individuals highlights the systemic barriers they face, particularly in the areas of employment, housing, mental health, and racial disparities. Studies indicate that systemic discrimination in hiring and housing remains a significant obstacle to reintegration. Employers often reject applicants with criminal records despite Ban the Box policies, which are designed to reduce hiring bias. Similarly, housing restrictions, including the exclusion of individuals with felony convictions from public housing and rental markets, contribute to housing instability and homelessness, increasing recidivism risks. These structural barriers prevent individuals from achieving long-term stability, making successful reentry nearly impossible without policy interventions and systemic reforms. Beyond economic and structural challenges, formerly incarcerated individuals also experience severe psychosocial impacts, including post-traumatic stress disorder, depression, social alienation, and difficulties rebuilding relationships. The trauma of incarceration, coupled with the stigma of having a criminal record, often results in social isolation and increased vulnerability to mental health and substance use disorders. These challenges disproportionately affect Black and Hispanic individuals, who are more likely to face harsher sentencing, stricter parole conditions, and reduced access to reentry services. Racial disparities in post-incarceration experiences further reinforce systemic inequities, with research showing that individuals from marginalized racial and ethnic backgrounds are more likely to face longer unemployment periods, higher housing rejection rates, and harsher supervision requirements compared to their white counterparts. Despite the existing body of research, several gaps remain. There is limited focus on the gendered experiences of reentry, particularly the unique challenges faced by formerly incarcerated women, who often contend with caregiving responsibilities, gender-based discrimination in hiring, and higher rates of trauma. Additionally, there is a lack of longitudinal studies examining the long-term impacts of employment discrimination and housing instability on formerly incarcerated individuals. Most studies focus on short-term reintegration outcomes, leaving gaps in understanding how systemic barriers persist over time and affect long-term economic mobility and social stability. Addressing these research gaps is essential for developing evidence-based policies and interventions that promote successful reintegration and reduce recidivism. Understanding the barriers to successful reentry for formerly incarcerated individuals requires a theoretical framework that acknowledges the complex interaction between individual experiences, systemic policies, and broader societal influences. Three key theories, ecological systems theory, critical race theory, and labeling theory, provide valuable insight into the challenges faced by individuals upon release from incarceration and how systemic factors shape their reintegration outcomes. Ecological systems theory examines how multiple levels of influence, individual, community, institutional, and policy-level factors, affect reentry experiences. This perspective emphasizes the interconnectedness of personal, social, and structural elements in shaping outcomes for formerly incarcerated individuals. At the microsystem level, individuals must navigate personal and familial relationships while coping with the stigma of incarceration. The mesosystem includes interactions between social services, employment, and housing providers, all of which influence reintegration success. At the exosystem and macrosystem levels, structural barriers such as restrictive housing policies, employment discrimination, and legal restrictions limit opportunities for stability and self-sufficiency. By applying ecological systems theory, policymakers and social workers can better understand the multifaceted nature of reentry challenges and advocate for community-based interventions and policy reforms to improve reintegration success. Critical race theory highlights the role of systemic racism in shaping incarceration rates and reentry outcomes. Historically, criminal justice policies, such as the war on drugs, sentencing disparities, and over-policing in communities of color, have disproportionately affected Black and Hispanic individuals. These disparities extend into post-incarceration experiences, where racialized stigma, employer biases, and housing discrimination create additional barriers to reentry. CRT challenges the dominant narrative that individuals are solely responsible for their circumstances, instead pointing to institutional policies and historical injustices that contribute to cycles of incarceration and recidivism. Applying CRT to reentry work emphasizes the need for equitable policies, targeted support programs, and systemic advocacy to dismantle structural barriers that disproportionately impact communities of color. Labeling theory explains how criminal records contribute to social exclusion, internalized stigma, and self-fulfilling prophecies of recidivism. Once labeled as ex-convicts or felons, formerly incarcerated individuals often face widespread discrimination in employment, housing, and social interactions, reinforcing their marginalization. This societal labeling can lead to internalized shame, limited opportunities for social mobility, and increased likelihood of recidivism. Employers, landlords, and even community members may perceive individuals with a criminal history as inherently untrustworthy or high risk, perpetuating cycles of exclusion. Labeling theory underscores the importance of reducing stigma through policy reforms, fair hiring practices, and public awareness initiatives to support successful reintegration rather than reinforcing punitive cycles. Together, these three frameworks, ecological systems theory, critical race theory, and labeling theory, provide a comprehensive lens for understanding the systemic challenges that formerly incarcerated individuals face. By integrating these perspectives, macro-level social work interventions can better address structural inequalities, reduce recidivism, and promote sustainable reintegration pathways. A trauma-informed approach to reentry recognizes that incarceration itself is a deeply traumatic experience that can have long-lasting psychological, emotional, and social consequences. Many formerly incarcerated individuals experience post-traumatic stress disorder, depression, anxiety, and substance use disorders, often exacerbated by their time in prison, where they may have been exposed to violence, solitary confinement, and institutional control. Without proper support, these individuals are at an increased risk of recidivism, homelessness, and unemployment, as they struggle to reintegrate into communities that may not provide adequate resources for their mental and emotional well-being. A trauma-informed reentry model ensures that mental health support, workforce development, and peer mentorship are key components of reintegration efforts, addressing the root causes of instability post-incarceration. Trauma-informed reentry programs incorporate wraparound services, meaning they provide holistic, individualized support to formerly incarcerated individuals in multiple aspects of life. These services typically include mental health counseling, substance use treatment, case management, housing assistance, and employment training. By integrating peer mentorship, formerly incarcerated individuals are connected with others who have successfully navigated reentry, allowing them to develop supportive social networks, reduce isolation, and receive guidance from individuals with shared experiences. Furthermore, workforce training programs within trauma-informed models focus on career readiness, job placement, and employer partnerships to ensure that individuals have access to stable employment, a key factor in preventing recidivism. An example of a successful trauma-informed reentry initiative is community-based organizations that provide comprehensive, individualized services tailored to the needs of formerly incarcerated individuals. Programs such as the Fortune Society and the Center for Employment Opportunities have demonstrated the effectiveness of trauma-informed approaches in reducing recidivism by prioritizing mental health support, employment training, and housing stability. These programs challenge punitive reentry models, advocating instead for policies that view formerly incarcerated individuals as people in need of rehabilitation and community support, rather than lifelong punishment. Implementing trauma-informed reentry programs on a broader scale can improve long-term reintegration outcomes, break cycles of incarceration, and promote social justice. The barriers to successful reentry for formerly incarcerated individuals are shaped by a combination of structural barriers, social stigma, and lack of institutional support. These factors reinforce cycles of poverty, homelessness, and recidivism, making reintegration into society extremely difficult. Research and community insights reveal that restrictive policies, discriminatory practices, and systemic underinvestment in reentry programs are among the leading causes of post-incarceration challenges. Addressing these issues requires policy reforms, funding allocations, and public awareness initiatives that promote rehabilitation rather than continued punishment. Structural barriers remain one of the most significant challenges for formerly incarcerated individuals. Policies restricting access to housing, employment, and financial assistance prevent individuals from achieving stability after release. Many formerly incarcerated individuals are excluded from public housing programs due to federal policies that allow landlords to deny housing based on criminal records, disproportionately affecting those from low-income and marginalized communities. Similarly, employment discrimination persists despite initiatives like Ban the Box, as background checks continue to exclude applicants with criminal records, limiting job opportunities and financial independence. These structural barriers contribute to homelessness, economic instability, and increased recidivism rates, as individuals are often forced into survival-based behaviors due to lack of resources. Social stigma further compounds these barriers, as employers, landlords, and community members often perceive formerly incarcerated individuals as high risk, regardless of their rehabilitation efforts. Labeling theory suggests that once individuals are branded as felons, they struggle to shed the societal perception of criminality, leading to ongoing discrimination and exclusion. Employers often assume that individuals with criminal records are unreliable or dangerous, making it difficult for them to secure stable employment. Likewise, landlords fear legal liabilities and property damage, leading them to reject rental applications from individuals with past convictions. These stigmatizing attitudes limit social reintegration opportunities and exacerbate feelings of isolation, increasing the likelihood of recidivism. A lack of institutional support is another key factor hindering successful reentry. Insufficient funding for reentry programs, mental health services, and educational opportunities leaves many individuals without essential resources to rebuild their lives. Community-based reentry programs that offer job training, substance use treatment, and case management are often underfunded and unable to meet the demand. Additionally, access to mental health care remains a significant challenge, as formerly incarcerated individuals frequently experience PTSD, depression, and substance use disorders, yet face barriers in obtaining consistent treatment. Without strong institutional investments in rehabilitation and reentry services, individuals struggle to navigate the post-incarceration transition, increasing their vulnerability to economic hardship and reincarceration. By addressing these structural, social, and institutional barriers, policymakers and social workers can create equitable opportunities for reintegration. Strategies such as policy reforms to expand housing access, employment protections, increased funding for reentry services, and public awareness campaigns to reduce stigma are essential to breaking the cycle of incarceration and promoting long-term success for returning citizens. Successful reintegration after incarceration depends on addressing the most critical systemic barriers that formerly incarcerated individuals face. While many challenges impact reentry outcomes, employment discrimination, housing instability, and inadequate mental health and substance use support are among the most pressing concerns. These conditions create cycles of poverty, homelessness, and recidivism, preventing individuals from building stable lives post-incarceration. Prioritizing these areas for intervention can significantly improve reentry outcomes by fostering economic independence, housing security, and access to essential health services. Employment discrimination remains a major barrier, as many employers continue to reject applicants with criminal records, despite policies such as Ban the Box and other fair chance hiring initiatives. While some companies have adopted inclusive hiring practices, background checks and stigma still prevent many formerly incarcerated individuals from securing stable employment. Research indicates that steady employment significantly reduces recidivism rates by providing financial security and a sense of purpose. Expanding anti-discrimination protections, tax incentives for employers who hire returning citizens, and workforce development programs is crucial to increasing job opportunities and reducing the economic instability that fuels reoffending. Housing instability is another urgent issue, as individuals with criminal records often face barriers to both public and private housing. Many landlords and housing authorities refuse rental applications from individuals with felony convictions, making it difficult for returning citizens to find stable housing. The lack of housing options forces many into homelessness or unstable living situations, increasing the likelihood of recidivism. Advocating for policy changes that remove discriminatory housing restrictions and expanding transitional housing programs can help individuals secure stable living environments, which is a key factor in successful reintegration. Stable housing has been shown to reduce stress, promote community reintegration, and improve long-term social outcomes. Expanding mental health and substance use support is also a critical priority, as many formerly incarcerated individuals experience trauma, PTSD, depression, and substance use disorders due to their experiences in the criminal justice system. The prison system often fails to provide adequate mental health care, leaving individuals without coping mechanisms or continued treatment post-release. Trauma-informed care in reentry services, community health programs, and correctional facilities can help address untreated mental health conditions and reduce relapse rates. Increased funding for mental health services, peer support networks, and integrated substance use treatment programs is essential to ensuring long-term reintegration success. The rationale for prioritizing employment, housing, and mental health services is supported by research indicating that these three factors significantly reduce recidivism and promote long-term stability. Employment provides financial security and social reintegration, housing ensures safety and stability, and mental health care addresses the psychological impact of incarceration. By focusing on these core issues, policy changes and community-based interventions can create a more just and equitable reentry system, breaking cycles of incarceration and poverty. Engaging in self-reflection on implicit and explicit biases is critical in social work practice, particularly when advocating for marginalized populations, such as formerly incarcerated individuals. While I have extensive professional experience working in the reentry field, I recognize that my personal background has shaped certain implicit and explicit biases that could impact my ability to engage in effective macro-level change efforts. Understanding and addressing these biases is essential to fostering authentic advocacy, collaboration, and equitable policy development in reentry work. One implicit bias I hold is that I have never been incarcerated or directly involved in the criminal justice system. While I have listened to the lived experiences of formerly incarcerated individuals and have worked with them professionally, I have not personally endured the systemic barriers they face. My lack of first-hand experience with incarceration, criminal justice policies, and reentry struggles means that I must continuously ensure that my understanding is informed by the voices and perspectives of those with lived experience. Without actively challenging this bias, I risk making assumptions about what reentry success looks like based on my own privileged position, rather than truly centering the needs of the community. Research suggests that professionals working with justice-involved individuals must continuously engage in cultural humility, self-awareness, and active listening to avoid reinforcing systemic biases in policy and practice. An explicit bias I recognize is the privilege I hold as a college-educated Asian woman who has family support and no history of substance use or major mental health challenges. These privileges shape how I am perceived in society, often as low-risk, hardworking, and trustworthy, which is in stark contrast to how formerly incarcerated individuals, particularly people of color, are often viewed. This reality highlights the racialized nature of social stigma in reentry, as research indicates that formerly incarcerated Black and Hispanic individuals face heightened levels of discrimination, regardless of their rehabilitation efforts. Because of my privileges, I may underestimate the intensity of structural and social barriers that returning citizens encounter daily. Without intentional self-reflection and learning, I risk unconsciously minimizing their struggles or offering solutions that do not fully address the intersecting oppressions they navigate. These biases could impact my ability to collaborate effectively in macro-level social change efforts if left unexamined. For example, failing to fully grasp the psychological toll of incarceration might result in advocating for policies that focus solely on employment and housing without addressing the trauma and mental health needs of returning citizens. Additionally, my position of privilege may create a disconnect between myself and formerly incarcerated individuals, making it crucial that I actively defer to and amplify their voices in decision-making processes. To mitigate these biases, I must remain committed to cultural humility, continuous learning, and prioritizing lived experiences in policy advocacy. By fostering authentic partnerships with formerly incarcerated individuals, community leaders, and advocacy organizations, I can work toward collaborative, equity-driven change that truly supports successful reintegration.